Hey everybody, Dr. Price here. I just wanted to take a quick break from seeing patients and invite you guys to come in. This week we have a few openings for new patients, so I'm inviting you to come in for our digestive dysfunction evaluation. The reason I'm doing this is we found that a lot of our patients that come in to see us, whether they have low thyroid, they have fibromyalgia, chronic fatigue syndrome, peripheral neuropathy, diabetes, all of these chronic conditions, one of the common factors that we see with these patients is that they have some sort of a gut-based issue or a digestive-based issues. Most autoimmune conditions have gut-based digestive issues. And there are 5 reasons that happens. Number 1 is food sensitivities. A lot of patients, we actually inherited our genes from our parents, which got them from our grandparents and great-grandparents, and these genes have been passed down from generation to generation. Well, our food supply is completely different now than it was 30 years ago, with genetic modification of all of our fruits and vegetables, with the chemicals that we're feeding our animals for the proteins that we eat. There's a lot of exposure to things that our body is not prepared for, and that can lead to food sensitivities. So you've got to do the proper testing to see if you have food sensitivities, because when you eat those foods, they do cause an inflammatory response in the body and can actually lead into chronic situations like leaky gut syndrome, which can lead to autoimmune conditions. So the first thing we have to look at is food sensitivities. Second thing we have to look at is dysbiosis. There are good bacteria and there are bad bacteria in the intestines. And we want to have the good bacteria and we want to keep the bad bacteria under control. Well, exposure to the inflammation from food sensitivities and exposure to chemicals and exposures to a lot of different aspects of things can throw excess sugar, which is huge for our society, can throw this normal balance of good bacteria versus bad bacteria, it can throw it out of balance. And that's what we call dysbiosis, and that can lead to a lot of digestive disorders. Next is what's called SIBO, small intestine bacterial overgrowth. There's supposed to be a lot of bacteria in the large intestine, but not necessarily in the small intestine. So patients that have SIBO can deal with like flatulence and gas and bloating right after they eat. So that's another thing that needs to be determined. Hidden infections. Infections are huge. It could be a subclinical virus or bacterial infection. It could be a parasite. It could be a fungal overgrowth. There's a lot of different things that when they're in the gut that can wreak havoc on your digestive tract. And then poor brain function. The brainstem actually controls and modulates the function of the gut. It helps to make sure there's proper hydrochloric acid, make sure there's proper levels of digestive enzymes. Gut motility is controlled by the brainstem. So there are a lot of different factors that can lead to digestive issues. And a lot of our patients come in and they've gone through testing, they've gone through colonoscopy, they've gone through all these different tests, and they get diagnosed with diverticulitis, colitis, irritable bowel syndrome, different things like that. And a lot of times those diagnoses are just basic blanket statements because they really don't know what's going on. And the challenge is that they're not looking to the functional cause of what is the issue with your digestive tract. And that's what we do in our office. We look for the functional cause. We do it through metabolic testing, and then we provide treatment through functional nutrition and functional neurology, as well as chiropractic care. So I'd like to invite you to come in. Our special offer is typically for a new patient, the new patient process is 2 visits. On the first visit, you're going to come in, we're going to do a complete neurological evaluation with you so we can analyze your brain function, make sure everything's going well there. We're going to look over any labs that you've had done in the last 90 days, and we're going to analyze those using functional lab values so we can see any hidden problems there. And we've got a very detailed package that we're going to send you that has a bunch of questionnaires and a bunch of history questions, so you can basically let us know everything you've been through, and we can use that to kind of guide us as to where we need to go with further testing. So on that first visit, we're going to do the neurological evaluation. We're going to gather up any labs that you have, gather up your new patient packet so that I can go through and review all that, and then we're going to part ways. On the second visit, we're going to get back together, and I'm going to go over everything that I found in the neurological evaluation. I'm going to go over everything that I found with any labs that you brought in. I'm going to go over everything that I found in those questionnaires. That second visit is going to be very, very informative, and you're going to learn more about your body in that second visit than you've probably learned in all your other doctor's visits up to this point. So and at that point we'll discuss whether we feel like you're a good fit for our program, whether I think it can help you. If I can help you, then there's no other program that will help you like this program will. If I cannot help you, I will refer you to where I think you need to go to. So that's what our first 2 visits are, and you can read the article attached with this to find out more detail about the pricing and so forth. And I hope to see you guys in the office. Again, this offer expires this Friday at 5 o'clock. So give us a call and let's get you in. Okay, I hope to see you.